Okay, good afternoon, everyone. We stand here today with the shadow of 20 more COVID-related deaths hanging over us since yesterday's update, bringing the total of lives lost in Northern Ireland to 329. But these deaths must never become just statistics. These are individuals loved and cherished by family and friends, individuals who are now no longer with us. My thoughts and sympathies are very much with their loved ones, and I want to make a direct appeal to anyone who is having doubts about the seriousness of the threat from COVID-19. I also want to address anyone who is tempted to relax their guard on social distancing. Let them think about the 20 families grieving today. Let them think about those who have lost their lives. Let them think about the key workers that have perished across these islands and who we remembered with a minute's silence today. Because we all need to keep doing the right thing on social distancing. The vast majority of people are continuing to do that. Countless sacrifices in daily lives have been made, and it has been worth it. Because as a result, we have been beginning to see some tentative improvements. The number of patients in ICU continues to fall, and there were 34 COVID patients in ICU as of earlier today, and that was down from 57 the same day 3 weeks ago. Whilst overall the trends of admissions to hospital is falling, there are still 119 COVID-related admissions yesterday. But we must not lose our nerve or lose our grip now. There is too much and too many lives at stake. As the Chief Scientific Advisor warned earlier this month, Northern Ireland remains on a knife edge. And whilst I'm confident that we will have the capacity in our hospitals to cope, bed occupancy remains at a very manageable 67%, we must remain especially mindful of the impact this virus is having on our care homes. That's why more money and more staff have been made available for their fight against the virus. I've also asked for testing to be dramatically scaled up, with testing for all residents and staff reporting outbreaks or clusters of infections, and the Chief Medical Officer will comment on that shortly. Don't let anyone say this has all been overblown, because believe me, it hasn't. There is a risk that the important work done to save lives could lead to complacency in some quarters. The spread of the virus so far across the community has not been as serious as we first feared, but that doesn't mean the warnings were misplaced. It means the warnings were taken seriously and people stayed at home and kept their distance. Remember too that despite the intensive effort across our community, the impact of COVID-19 has been devastating. We had our first death in Northern Ireland on the 19th of March. And look where we are now. The mounting death toll is already on a scale not seen even during the worst of the Troubles. That's how serious this is. So please keep doing what you are doing, staying at home and save lives. Please cooperate and support with the police as they enforce these emergency regulations. This is not easy, but it has to be done. The COVID-19 pandemic has taken a massive physical toll on us all, but we must not, however, lose sight of the potentially catastrophic impact it will have on emotional well-being and all of our own mental health. That is why I believe now was the appropriate time to commence the process of appointing a mental health champion for Northern Ireland. And I would reassure all those listening that a time will come when we will be able to ease some of the restrictions. But that time is not now. I know the public will forgive me for being cautious about that. I don't want to start speculating on potential dates because we haven't reached that stage yet. I don't want people thinking or acting like it is imminent because it is not. But people rightly want to be treated like adults, and also to be assured that this lockdown will not drag on forever, because it won't. It will stay for as long as is needed, and no longer. We are, of course, planning for the next phase. We will be open and honest with everyone on the options before us and the choices to be made. It will not be like flicking a switch and going back to the old ways. Social distancing will be with us in some form for many months. We have decisions to make too on how we start ramping up vital hospital services that were scaled back to prepare for the coronavirus surge. That includes cancer care and mental health provision, and those decisions are under active consideration. I'll now ask the Chief Medical Officer, Dr. Michael McBride, to address.
Thank you, Minister. If I could just add my words of thanks to you as members of the public, as citizens of Northern Ireland, for the efforts that you have made, efforts that have undoubtedly saved lives, that have undoubtedly ensured that our health service has been able to cope, has undoubtedly ensured that everyone who needs the professional and expert care has been able to receive that. But as the Minister has said, now is not a time to drop our guard. As the First Minister and Deputy First Minister have said, now is not the time to grow weary or impatient. We still have work to do. We are not still through the first wave of this infection, this pandemic. I know it's very difficult when you look and you watch the pattern of spread of activity around Europe and where other countries are beginning to both relax and talk about relaxing measures. We are not all in the same place at this time, and that is crucially important for us all to remember. It is too soon, it is too early for us now to lose the ground that we have made. The decisions that you and I make over the next number of weeks, whether we adhere to or not the social distancing measures and the advice around hand hygiene, good respiratory hand hygiene, will make a difference in terms of lives saved or not. I would just ask all of you to reflect back a few short weeks ago, and I referred to these in my comments at that time, about the heartfelt appeals from those who have lost loved ones to heed the messages, to stay at home, to protect each other, to protect yourself, and to save lives. And I would also ask you to reflect on those heartfelt messages from those working in the front line, whether that's in our care sector, whether that's in our hospitals, whether it's in primary care or wherever that might be. We have a job of work to do, and complacency remains our greatest enemy at this time. The Minister mentioned testing and the expansion in testing. Testing has always been a very important part of our strategy in terms of how we face this virus and informing the actions that we take. As we moved from the containment phase, as you'll recall, back on the 12th of March, we were at that point in time actively contact tracing, actively testing individuals who had travelled from other parts of the world. When we then moved to a situation where there was widespread community transmission here in Northern Ireland and right across the United Kingdom, we moved to the delay phase. We are now ramping up our testing capacity very significantly. I'm very grateful to all our partners across the HSC trusts, the laboratories, our partners in the universities, in industry, and at other arm's length departments of government such as AFB. We have worked tirelessly to increase our testing capacity, and we're now in a situation where we can use that capacity to begin the very important community surveillance that we now will require in the next phase of our response. So that will involve testing individuals in our GP spotter practices, the 13 practices in the Belfast and South Eastern Trust area, which went live this week, gradually rolling that out to the other 26 practices across Northern Ireland. That will provide us information about how this virus is behaving on the ground in individuals who are presenting with respiratory symptoms. We have this week also started testing individuals with respiratory symptoms presenting to our emergency departments. We have also, and have this week, as of yesterday, started testing all admissions to our hospital for either emergency care or for elective care. As the Minister has also indicated, we have also begun, at his instruction, testing all individuals who have been admitted into care homes. So that's those who are in our hospital setting, and those individuals being tested 48 hours prior to discharge into nursing or residential care home facility, and indeed all of those individuals who are being referred into the care home sector, whether that's from supported living, from their own home or elsewhere. That, and along with a range of other detailed interventions updated in guidance that the Minister launched yesterday, and including a support package to the health care sector, independent sector providers, is part of a parcel of measures that we have put in place now to ensure that we respond to the challenges that we are facing. It is crucially important in the next weeks and period ahead that not only do we expand our testing capacity further, but that we use that testing capacity intelligently. As we begin to plan for the next phase, as the Minister has said, we need to have an intelligent conversation about when and in what manner those social distancing measures, those physical distancing measures that we have put in place will be relaxed, but that is not now. We need to be using our testing capacity differently at that time, because then we will return to elements of the containment phase, because then we will be dealing with local outbreaks, local transmission chains, and it will be up to all of us to engage fully with that phase of our response so that we ensure that we continue to keep the virus and the spread of the virus under control. I just want to again reiterate this point because it's crucially important. The balance between success and failure, the balance between keeping on top of this virus, ensuring our health service can respond, ensuring that we can all access the care that we need, is a fine one. We have all paid, as the Minister said, a very heavy price over the last number of months, measured perhaps most acutely in terms of lives lost, but also in terms of those who've had admissions to hospital, those families and friends who've had very worrying times and experiences, our healthcare workers, wherever they are working extremely long and challenging hours in very difficult circumstances. It's now up to you and me and everybody else to ensure that we keep that reproductive number, that we ensure that we break the cycle and chain of infections. At the moment, we estimate that for every person who's infected with this virus, somewhere in the region of 0.7, 0.8 of a person is infected, so it's below 1. And when we keep it below 1, that means we're not seeing exponential growth in terms of the spread of the virus. If we drop our guard, as the Minister said, we will rapidly return to exponential growth in this virus, and that will claim more lives. It will put more pressure on our health service. And as I've said many, many times, please let none of us look back and regret not taking steps now that we wish we had. So please continue to heed the strong messages that have been communicated from the Executive, from the Minister and all Ministers. Stay at home, protect yourselves and protect each other.
Health Minister, Chief Medical Officer Mark Devonport, BBC Northern Ireland, a two-parter. First of all, the Scottish First Minister Nicola Sturgeon has today advised people in Scotland that they might consider putting cloth face masks on when going out into areas where it's difficult to socially distance, such as shops or public transport. You've seen similar medical and scientific advice, no doubt, to that which the Scottish Government is privy to. Would you endorse her message and repeat it to people in Northern Ireland? And also then picking up on some of the details on testing that the Chief Medical Officer has set out. I think we compare well with other UK regions, but we're still running at, I think, less than half the rate of testing of the Irish Republic. Has the problem been a lack of capacity up until now, or given that there's anecdotal accounts of some of the testing centres actually not having been running at full capacity, indeed, and been running very much below capacity, has it been a problem of getting the tests to the people who need it, be they in care homes, hospitals, or wherever?
Thank you, Mark. In regards to your first point, in regards to face coverings, it's a conversation that actually started in the executive this week, but it's a conversation that will be had within the executive, supported by medical advice and guidance. But one thing that would concern us is that face coverings actually lead to a false sense of security. And we see those other measures in regards to good hand hygiene, social distancing, then start to become less prevalent, and people rely on a face covering more than they do on the advice and the guidance that we've been following for the past number of weeks, and the advice and guidance that has been working for the last number of weeks. So that conversation has been started in the executive. In regards to our testing capacity, I think, as I said to the Health Committee last Thursday, one of the things that we've been doing and purposely doing is increasing our capacity and then expanding who can be made eligible or who is eligible for testing. Because one of the things that we didn't want, or I didn't want, was actually to get in front of the capacity that we had. So it was important for me to make sure we had the capacity before those groups were expanded. So as our capacity has increased, that's why we've been able to open up to different groups, and that's why we're now moving into that testing capacity within our care home sector. Michael, do you want to?
Yeah, just to maybe expand on that, if I may, Minister. I mean, I've sort of three simple points to make by way of response. What we must not lose sight of is the important message is that if you are symptomatic, you and your entire household need to self-isolate. That's the most important point that we mustn't lose sight of. Secondly, it is hugely important that we still continue to adhere to the guidance on stay at home, and only in limited circumstances should you leave home. The most important thing to do when you leave home is to adhere to the advice on physical distancing, on good respiratory and hand hygiene. Wearing a face covering must not be seen as a substitute for adhering to that guidance and advice on good respiratory and hand hygiene. That is the most important thing. There is some limited evidence, and it is limited evidence, that if you are in an enclosed space and unable to adhere to the advice on social distancing, then the wearing of some form of face covering may be of benefit. But the benefit is marginal, to say the least. And I understand for that reason in Scotland the advice is not mandatory, it's not going to be enforced, but again, as you quite rightly have said, it's on a precautionary basis. But ultimately, these are policy decisions which ultimately will be matters for the executive to decide. I think the second point in relation to testing, it's really important that there's timeliness in the reporting of testing. It's quite easy to take lots and lots of tests, but if indeed those results aren't available to individuals within a short turnaround time, then you still have the net result of people staying at home for long periods of time without a test result. Again, I just want to put on record my huge thanks to all of the laboratories here in Northern Ireland, the Regional Virus Laboratory, all our laboratories across all our trusts, and the academic consortium involving Queen's University, UU, AFBI, CETRIC, AFBI, and again, a number of our industrial partners now coming online. We do compare well and favourably with other parts of the UK, and we have also benefited from the UK-wide partnership programme in terms of expanding the testing to healthcare workers and other essential workers.
Good afternoon, Vicky Hawthorne at UTV here. For both Minister and the Chief Medical Officer, are you concerned with anecdotal reports of more traffic on the roads and some businesses returning, that there is kind of going to be a unravelling of the lockdown, if you like, by stealth? And would you like to see more enforcement of the restrictions if that is the case? Also, just back to the testing, probably more for Dr. McBride. Can you break it down into exact figures? You say it's being ramped up significantly. Can you give us an insight into exactly what the figures are and just by how much the testing is increasing?
Thank you, Becky. And again, no, in my opening comments, and I've said this before, complacency at this minute in time is our biggest enemy. What we can't afford is to see the vital gains that we have made, the lives that we have actually saved by people conforming to the guidance and the regulations that we recommended a number of weeks ago. So the enforcement of those regulations, I don't personally want to see us getting to a stage where that's necessary, but if it is, I welcome that. But what I would rather see is the people of Northern Ireland still adhering to and respecting the guidance and the advice that we put out, because it has saved lives. So this is about a personal responsibility as well. No one is immune from this virus. No one should perceive that they have the immunity, that they can go out and flout the rules and the guidance and regulations that we've been working to so successfully over the past number of weeks. Because those individuals that think they're immune, they may carry the virus home to a loved one. And it's at that point that their actions will have a direct toll, not just on the health service and the pressures that we have, but also on their family members as well. So am I concerned about a relaxation and a selfishness in regards to some of the members of the community of Northern Ireland? Yes, because we have to do this for a number of weeks, because it's about saving lives. But I'm also thankful for the vast majority of the people of Northern Ireland who are adhering to and following this guidance and advice, because their actions is saving lives.
Yeah, just to respond to that, and the Minister alluded to the numbers of individuals in intensive care at this present moment in time, and thankfully that those numbers have dropped, as indeed have the numbers of people in hospital with COVID-19. If we drop our guard now, those numbers, 30, I think it was 34 individuals in intensive care, those numbers could double within two weeks' time. That's how finely balanced this is. So any relaxation, any stepping back from the massive commitment that we've seen from the public over the next couple of weeks will have very significant consequences in terms of more individuals admitted to hospital with COVID-19, more individuals in our intensive care, more pressure for staff, more outbreaks in terms of our care homes, and greater challenges for all of us. So now is the time for the public of Northern Ireland to continue to do what they have been doing very patiently, keeping to the guidance and to advice. And I just want to put on record my thanks to the PSNI for policing with consent, using the reasonableness test that they have been applying over the last number of weeks, and working with the public. It's crucially important that we recognise that this is tough, this is hard, this is not easy, and it's crucially important that we have the support of you in the media as well, in terms of ensuring that that discourse about these measures and how vitally important they are is communicated and is understood. And I understand entirely, I watch the news too occasionally when I have the time, and I understand how difficult it is when you see and hear reports of relaxation of measures across the world. And it's almost the reverse of the problem that we had in the early phase of this, where we saw the pandemic spreading earlier in some parts of Europe and some parts of the world. We are just not there where other parts of Europe are at this time, other parts of the world are, and it's crucially important that we all realise and recognise that.
Health Minister, Chief Medical Officer David Young from the Press Association. I just wanted to get a question, maybe this is one for yourself, the Chief Medical Officer, but in terms of the data and the indicators of the virus, we talked about the R number, ICU admissions, hospital admissions. Where do we need to get to in regard to those key indicators before we can start to think about easing restrictions? And I suppose linked to that, are we on the right trajectory at the moment? I know trends are going in the right direction, but are they going in the right direction quick enough for ministers potentially to contemplate, even minor changes when we come to the middle of May? And just a secondary question, if I may. You may be aware of the data in the Irish Republic that shows relatively quite a high prevalence of the virus in certain border counties. Has that any implications, or do you see any link in terms of movement across the border? And if so, what is the response, and what are the consequences of that?
Well, certainly dealing with your last question first, I think that, and again, as my counterpart Tony Houlihan said in recent days, I don't think that that relates to spillover across the border one way or the other. It's quite clear that the population in the Republic of Ireland, as the population in Northern Ireland, as I've said earlier in response to a previous question, has been adhering to the advice on stay at home and the advice on social distancing, and the population on both sides of the border need to be congratulated on that. I think it's also fair to say, as both he and I have said, that the spread of the epidemic in Northern Ireland and in the Republic of Ireland is broadly similar. So no, I don't believe that there is a leakage of infection across the border for those reasons. There's absolutely no evidence to suggest that. In terms of your first question, as I say, that our aim through all of the measures that the Executive has put in place based on the best available evidence and science has been to keep that R value below 1. When we started back prior to the introduction of the measures that everyone in the public has referred to as lockdown, that R value was sitting at about 2.8. So that meant for each one of us who got infected, we were infecting up to 2.8 individuals. Had that continued, our health service, as the Minister said at the time, would have been overwhelmed, and the death toll that we would have seen as a consequence of that would have been staggering, quite frankly. As a result of the decisions taken by the Executive, the measures were put in place and the actions we all have taken as citizens, thankfully we have avoided the worst excesses of that in this wave. There may well be further waves, and I say further waves because we have no guarantee in such times as we have effective treatments or a vaccine that there may not be further waves of this virus. What we do know from the modelling is if the R gets much above 1, then again we will return to a situation where we have exponential growth in the virus. We know that because this is an extremely transmissible virus. And then we would anticipate that if we relax too many of the measures too soon, then what we will do is see, again, that pressure mounting on our health service and that death toll climb. So the advice that we will provide to the Executive and to ministers in terms of making the decisions will be based on the best scientific advice that we have internationally from experience of what's happening in other countries around the world as they begin to ease back some of those measures, from the scientific advisory group on emergency, SAGE, as you will have heard referred to, but also from our own teams here in Northern Ireland who are doing Northern Ireland specifically modelling and also working very closely with their counterparts in the Republic of Ireland. So in all of this, it's difficult to give you an exact answer other than the fact that we are watching and observing and learning from other parts of Europe and internationally, and again ensuring that we have all of the evidence and all of the modelling so that ministers can make the best possible advice in terms of which measures we might consider stepping back and in which order. But as I say, and as the Minister has said, and the First Minister and Deputy First Minister have said, we will have a mature conversation about that. But again, my concern as Chief Medical Officer is that we don't basically lose our way after all the gains that we've made and think that somehow or other we're through the worst of this, because we may be through the peak, indeed are, of this wave, but we could very quickly end up where we were a few short weeks ago if indeed, as was said at an earlier question, if our response as a public begins to unravel at this time.
David, can I just come in there as well? As again, when the Chief Medical Officer talks about the modelling that we as a health department present to the Executive, it is exactly that. It is modelling. It's not a prediction, it's not a forecast. So that modelling is based on us experiencing and reflecting on the behaviours that we're currently seeing at this minute in time. It's based on the number of cars that we see on the traffic. It's not the number of people that are on the streets, it's the number of people that are entering shops. So that modelling is predicted and predicated on those behaviours that we currently see now. So that's why it's vitally important that those behaviours are maintained, because when people of Northern Ireland start to change those behaviours, that's the direct effect that it has on the modelling. It starts to show the increase on the need of hospital admissions, on the need of ICU beds, and then also pushes up the number of potential deaths.
Minister Swann, Dr McBride, Lauren Hart here from the Belfast Telegraph. A question for you both, first of all, and obviously you've talked about the importance of maintaining the lockdown and not dropping our guard, but can I ask you both if you think the ongoing lockdown will ultimately cost more lives than it saves, particularly in terms of missed cancer referrals, reduced hospital attendances, obesity, mental health and poverty, obviously taking on board what you said, Minister, about beginning the process to appoint a mental health champion. And secondly, you're probably aware of some figures out today from the police regarding the number of calls they've received, almost 2,000 in the first 3 weeks of April in relation to domestic violence. Obviously, the PSNI had previously predicted a rise in this issue during the pandemic. So can I ask you both for your response to these stark figures? And I suppose given the potential for these to rise even further, given how long the lockdown goes on, obviously taking on board as well the fact that the Justice Minister has addressed this issue today and she is working on bringing legislation forward, but it may not be quick enough for this current situation.
And in regards, in the balance that we take in regards to the actions and the scaling back of certain procedures that we did when we went into our surge planning, all this was taken into place. But as the Chief Medical Officer and I have said, standing at these briefings before, we do have to take into account of the effects that lockdown does have in regards to mental health, and that's why I moved to appoint our mental health champion. One of the New Decade, New Approach commitments was to bring forward a mental health strategy and a mental health action plans. One of the direct asks and one of the direct actions in that was the appointment of the mental health strategy, because what we're seeing at this minute in time is the pressures of people being in this lockdown scenario at this minute in time and following the rules and regulations. So it's vitally important that I as Health Minister and my department and the officials within it make sure that we're putting measures and steps in place to provide the support that is there. And it's not just for support for the individuals who are currently experiencing the challenge of lockdown, it's also the mental health strains and stresses that are actually on our frontline workers at this minute in time as they deal with COVID-19 on a daily basis. So it's the steps that we're taking in regard. And as the Chief Medical Officer has said, and I have said standing on this, we have to be cautious of the adverse effects of lockdown, and especially in regards to domestic violence and the number of police calls that have increased. And that's why we've been working with the Justice Minister and with our other blue light services to make sure that there's a coordinated response to the changes in the delivery service that we all have to provide at this minute in time.
Yeah, just to build on that, Minister, I think we're all acutely aware of the impact that the steps that we have taken. Maybe I could answer that in 3 parts. Firstly, it was absolutely clear that had we not, and the Executive not taken the decisions and put in place the steps that were put in place, there would have been many more people would have died directly as a consequence of COVID-19, and many, many more people who would have died because our health service would have been overwhelmed and not been able to access the care that they need. As Chief Medical Officer, as Minister has said, he and I and the entire Executive are acutely aware of the impact in terms of those individuals waiting for urgent treatment and care, the steps that we've had to take to step down screening services, to step down cancer treatment because of the risk that it would pose to individuals to have very aggressive chemotherapy at this time and the risk of COVID-19 should they become infected. The huge impact that it's having on the shielded population in Northern Ireland who have been advised to stay at home for now many, many weeks. Many of those elderly individuals, many of them with long-term conditions. But then the third element of it is the wider and longer-term impact, as you've quite rightly said, in terms of the psychological consequences of this, the longer-term mental health impacts, the fact that, as I've said many times, we need to be acutely aware of the wider socioeconomic impacts. Poverty has always killed people. It disproportionately disadvantages those poorer individuals in our society. Unemployment kills people, and good employment is good for our health. So the longer term consequences of this, I think we still need to work our way through, and absolutely needs to be part of our thinking and planning and preparation as we consider in the months ahead as to how we build our way back out of the actions that we have had to take at this very difficult time.
Thank you.